this is a common ground of the heart today. I'm really just so excited and pleased to have you both here and have a conversation with Kira and I. It's friends having conversation with friends and connecting, and I just want to publicly thank you both for being part of my journey, and professionally and personally it is an honor to have walked with you both through many years.
What I will say is why this is so special for me. So far, all of our common grounds have been with professionals that we highly respect, that we refer to, that we feel connected to in terms of the way we see things, and just admire the work that they do. There's an added layer here for us because not only are you that, but we know you in other ways that you guys can talk about. When you start to see people that you've known in various ways come into their own, heal, recover, grow, and then start as professionals helping others do that, and knowing we were part of that, that I was part of that, it's just very powerful. Like I couldn't be any more proud, lucky to be a part of it. So that's why this is so meaningful to me. And I can't wait to hear what you guys have to say.
Kira.
Glad to be here. Thanks for having us.
Yes.
Erin, do you want to share first about who you are, what you do?
Yeah, so my name is Erin, and I am a therapist right now I'm at Atlanta Specialized Care, and I have my offices in Dunwoody, and really I specialize in substance use and adolescence and working with families. And the reason why I have chosen that field is because I'm a person in long-term recovery. And I was lucky enough to kind of, go through my recovery journey when I was really young. So I was very young actually. And so that's kind of why I really enjoy working with the adolescents, because I can kind of empathize with them, but also working with the families because I know how hard it was for my family. Going through their own recovery and watching me go through mine. And so that's something that I'm really passionate about, is kind of to like getting to be there for the families that I work with, and helping them. And, both of you have been, and Nina even as well. We were kind of talking about this earlier. All three of you have been imperative in my journey. Beth, I mean, you were very active when I was a resident at Hope. And Kira, you were the reason that I'm doing what I'm doing today, because you just were exactly who I needed at that time. And then even Nina, when I was a little baby social worker, she got me my second internship, and I really got to sit in with her and watch her do groups. And she really formed and molded the type of therapist that I wanted to be, because just watching her was so great. So it's just so cool and just full circle that I'm able to sit here today with all three of you. And it's just mind blowing. So I don't know if I went off on a little tangent, but that's just a little bit about me.
It is mind blowing and pretty surreal actually to be here sitting to you guys with all of you. I first met Beth, let's see, it's like in 2004, long time ago, over 15 years ago, 16 years ago, 17 years ago. Hope Recovery came into my life back then, a long time ago. I went to treatment for substance abuse when I was 19. So after treatment, my dad told me, Nina, you're not allowed to come back into the house. And I was like, really? What the heck? I just went through treatment. I'm not allowed back in the house. And I went into Hope Homes. And I was talking to Beth about this a few weeks ago. And when I look back on my time in Hope Homes, to me, I kind of equate it as like my college experience in a way, because it was like, I didn't really go live in a dorm and live on campus life, except for that one semester. So for me, like my 2 years in Hope Homes, when I was in my early 20s, was like a coming of age, my chance to like bond with friends, and have laughter for the first time, like real laughter, learning how to live away from my parents, but also having like the structure that I needed, so that I could get used to being sober and learning how to live this different way of life. It was a time when I remember testing the limits and getting on restriction during my time there. And that was good for me. Like I hated it at the time, but I learned how to follow the rules, and when I do things that aren't good, I'm going to feel some consequences, and I needed that. I needed that gentle kind of structure at that time, and really like fond memories, fun times, and going to 12-step meetings and grow, all the while growing. And so I had a lot to learn, and I had a big void to learn to fill in a healthy way. And anyway, so Hope Homes is very near and dear to my heart. And I didn't know what I wanted to do. I didn't have like a passion, like, I was definitely on fire about recovery, but just I kind of went with what was interesting to me to study, and mental health was very interesting, and psychology and helping others. So I started taking classes and learning more about it, and kind of doors just started opening, and it felt right. Like I was going down the career path that I was supposed to be going down. Fast forward like over a decade. My husband and my husband's in the profession too. He's a psychologist. We opened our own private practice a little over a year ago. We kind of wanted to venture off and do it our own thing. We're both very passionate. We do individual therapy. I see people with substance abuse problems, depression, anxiety. And lately I have felt a calling to go more towards body image and eating disorders. That is an area that is also near and dear to my heart, and something that that's what I love, the specialty that I love to work with.
That's awesome, Nina. Thank you.
Mhm.
And, it's so gratifying to have you both, because you are such accomplished professionals that we trust, and that's not something that we give, and I know you too, lightly, that we trust when we refer to you, that needs are going to be addressed and accurately assessed. And even more than that, you're going to collaborate with us really well. One, because of course you understand very well what we do and don't do, for that matter. And so it becomes a synergistic relationship. but also you all, you just have that lived experience that we really value. We call it the social model, and actively use that lived experience in tandem with our ability to work professionally, assess all of that. And you naturally do that kind of approach, not in a peer-based way per se, but you do it with a very intentional approach. And I appreciate so much you being so transparent and sharing and your history and all of that.
It's great. And did we meet in Hope Homes? Because I know we were kind of like, you were on your way out when I was kind of coming in. So we all had like the same group of friends, which are still some of our best friends that I was a roommate with in Hope Homes.
And I knew your sister. Her
Yep.
sister is also in recovery. And I was close
That's
with
right.
her before Erin even came into the rooms of recovery.
Yeah.
And I remember her sister talking about her, I just don't know if my little sister is ever going to get it there. And then she and I became close, and I mean.
Well, she's for you what Kira is for me, it sounds.
Yeah.
And, what a beautiful thing that we can have that community with each other in all the important parts of our lives, So let's unpack some of this. You guys have shared so many good nuggets. I like to circle to just your professional and personal insights about just the recovery process and young adults particularly. You both work with families and have passion for the young adult population. What do you see as challenges for both the young adult population and the families that love them? What do you work with the most right now? What do you see as trends? Things like that you'd like to share.
So I think for me, and this is something I guess is personally I can really relate to, but what I see a lot, especially in the young adults and their families that I work with, because when you're in your late teens or early 20s, you're really starting to, of course, naturally want to earn this independence and start to venture out on your own and do your own things. But oftentimes families are not, because of previous decision making or some kind of consequences that they're still kind of dealing with. Families just really have a hard time with finding that balance of how do I provide these boundaries versus how do I let you be a 19, 20-year-old, normal 19, 20-year-old, and how do I trust that you're going to be okay? And that's I think really, really difficult. It is kind of this, and every family is different, and every young adult and every parent, they're going to require different things, but it's really like this dance, and trying to find what works for them. And I think about why when I was in Hope Homes and I was young, that was really, really helpful for me because it allowed my parents to be my parents and no longer the people who had to provide consequences or make sure that I was in at a certain time or, doing all of these things. They were able to be my parent, and then Hope was kind of able to step in and do that. And so that's what worked well for me. So I think it's, trying to get creative and figure out what works for the family, what boundaries feel right to everyone, and when to step back and when to kind of lean into the parenting consequence role, I guess.
That's
Such a
really
scary
helpful.
thing.
Yeah. That structure because for the young adult, they don't have it. It's not like rehab is relearning something. This is actually habilitation, learning for the first time.
Yes.
And we, as young adults in recovery, learning how to get out of bed, like you were talking about, Nina, that, if I'm going to be a functional adult, I can't sleep until 2:00. And so when parents are in that position of having to be the structure implementer, it's wearing two hats. So I really appreciate what you said and shed light on with that can get really messy when we have to wear those two hats.
Yeah, and there's also the dynamic of, I mean, a 19-year-old rebellious kid, they don't want to listen to their parents. There's already this history of this tug and pull, get clean, don't do this, get home, you're grounded. And so, yeah, going to a totally different environment and hearing it from someone other than your parents is important. And also I think about from a young adult's perspective, I mean, it's so normalized, like in clients that I work with now that are, trying to figure out, like, am I, do I have an addiction problem, or am I just partying too much? Or, it's normalized in college campuses and in some group of friends, and depending on the peers that you're hanging out, it could be totally just a normal thing. Being around that, it's a lifestyle. So that, I mean, for me, as getting in recovery as a young adult, still having fun and being able to go out at night on Friday and Saturday night with other young adults, and just be silly and crazy like a 20-year-old, but in a way that wasn't like detrimental to my well-being. That was so important. I don't know if I would have made it or if I would have stuck around if I felt like I had to be, this old Betty, and which is what I thought, right? Getting sober, like my life is over. I'm going to be, in the house at 8:00, and, what am I going to do? I had no idea. What do you even do now that I'm not drinking or using? And so realizing that I could still have fun, I could still hang out with people, and that there was a healthy way to do that, that was going to still fill that need, was important. And another thing, one thing that I see sometimes with parents is one parent has one way of doing things, and then the other parent has another way. One may be totally lax and like, we don't need to do consequences, and he's just going through a hard time. And the other one is like, I'm ready to throw him out and be done with him, and, something like that. And so that's always sad for me to see, because it really is a family disease. It impacts the whole dynamic of the family, and helping something, that I've done is help the parents to kind of get on the same page and to validate each other's needs, and that they both want what's best for their child and love their child, and are just going at it from two totally different ways, and kind of reconciling that. And yeah, and like Erin said, every family is totally different, but I do think it's like a a fine line of like, okay, there has to be like some things, this is not okay to happen in our house. But also like 20-year-olds, like you said, Beth, developmentally are at a different place than a 50-year-old, parent. So having reasonable expectations and kind of that stuff that we talk about. And then of course, like taking care of themselves through what can be devastating to watch, your baby go through. I mean,
It's traumatic.
yeah.
Dramatic.
Now that I have kids, like I can't even, I have more empathy for what my parents went through. Like I just that they must have felt and the fear and yeah.
Yeah,
Yeah.
that state of hyperarousal, constant hyperarousal. And when you have that for years, sometimes it does damage psychologically, physically, all of that. And so many of our families don't even realize that, right? So just walking through your doors is the first step to healing, I think, right?
It's
Yeah.
it's a delicate balance too, like Erin said, supporting both the parents and the young adult so that everybody gets, I don't mean confronted in a conflictual or adversarial way, but to acknowledge the work each needs to do and have everybody still feel supported. I don't think we can do it alone as professionals. And so, I mean, that's one of the reasons that we do a family support group. And it's amazing to watch these parents support one another, talk about their own journeys and experiences of where they are, what's worked, what's not worked, to have other people that understand the fear and the grief that this isn't what I dreamed for my child, or they're not where I thought they might be. And to what you said, Beth, that I don't think people even realize the level of trauma that they're in because it's so chronic that it is normal. It feels normal. And so there's this lack of clarity of, is this as bad as I think it is? Is it worse? Is it, I don't even know to trust my own perception of what this is. Nina, to your point, the young adult wonders, maybe this is just normal using, like what everybody else is doing. Parents are like, am I being too hard on them? And I think sometimes, Nina, with parents that aren't on the same page, sometimes helping them see that when one is controlling and very bounded and very rigid, the other parent may overcompensate by not having boundaries, right? And because that parent doesn't have boundaries, or maybe that's where that starts, then the other parent goes to over controlling, and that they're compensating for one another. And when they do feel supported and you're able to help them integrate and realize that their goals are in line and in tune, they can work together to be the right amount of support and boundaries for their child. I think the separation that you talked about too, the physical separation, when parents aren't in that position of authority and treating them as a young adult might think, treating them younger than they chronologically are, they can work on more developmentally appropriate boundaries, like how much money do we give them? I mean, that's pretty typical, whether a young adult is using, has substance use disorder or not, right? It's how much do I support? How much do I, not financially? I mean, there's so many developmentally appropriate things that they can continue to work on when they're not having to work on, you need to get out of bed. Have you looked for a job today? How many applications did you put in? This kind of micromanaging because they've had to do that. So it's an opportunity for them as well to work their own program. I think that's, how you referred to it, or maybe Erin, you did, but their own healing journey.
Yeah, absolutely. And to your point about you guys having a family group, I know for my parents, they didn't talk about, my problems with family members, or I mean, they didn't have a support system. So they were having all of those huge, big, intense feelings and emotions and stress and trauma with being isolated. And so, when they did meet other families, members, and parents that had kids that were going through similar things, I think it was such a, okay, I'm not alone, which is huge. That's, I mean, so much healing comes in. Oh my gosh, you have felt this too. So.
Well, I think too, like a lot of the families that I work with, they feel a lot of guilt for having those thoughts and for having, like even if the young adult or the kid is like arrested or going into treatment, it's like that first night, a lot of the parents will be like, I got the best sleep of my life for the first time. And they feel such guilt about that. And it's like, because you knew they were safe, even if, even if they were in, the holding cell for 24 hours, you knew they were safe in that moment. And talking to other parents, we get that as people in recovery, we get to check in with people and be like, oh, you have crazy thoughts? I also have crazy thoughts, and it's like it normalizes it and it just makes you feel it's a community. I mean, it's such an important part of recovery. And so when parents are able to do that and it becomes normal for them, what a huge relief and what a gift that is. To, on one hand, love something so much, they're your child, and on the other hand, they drive you insane,
Yeah.
and just knowing that that's normal.
Yeah.
When Beth was talking about why we feel so good about referring to you, one of the things I wanted to add to that is that we know they'll be cared for. You know what it's like to feel completely incompetent as a young adult. Maybe you felt like I don't know how I'm gonna be able to have fun without this, or maybe you've experienced such intense anxiety that you didn't think you were capable of getting through school or something like that. And having come through all of that, not that you always feel 100% competent now. I think we all have days where we question ourselves and second guess ourselves. I do. Which I think just keeps us growing. But to have come through all of that and to be able to relate to the young adult or the adolescent that's sitting with you saying, I can't do it. I can't do it. I can't go in and apply for that job, or I can't take that test. I just can't. And now you have master's degrees and letters after your names.
Crazy.
And like letters that are hard to get. Yeah, really important letters. You, without saying anything, sitting in a room with them, they know that. That's why I refer to you. That thing that you don't even have to say, because there's a way that you are sitting with them that is without judgment and accepting, unconditional positive regard.
Well, I think too, it's also for me and all of those things. Yes. Like I know what all of those things feel like. I know, sometimes I still feel like a 19-year-old girl in this woman's body. I'm like, we need to find an adult, but I'm the adult. I feel like that all the time. But getting to sit in a room with a teen or a young adult who's going through, who feels completely like they have no choice in the matter. All of this is out of their hands. Everyone is making decisions for them. It's really important to me that I'm able to give them some power back or give them some ownership into their journey, because when they're able to say, this is my choice, or even if the choice is between this therapist or this therapist, who do you want to go see, it's still when they're able to make those choices and have that like some decision making ability, it empowers them, it gets them more motivated for the journey. And that's something that's so important to me, because I remember those moments in my early recovery where I got to make that choice and I was empowered and I felt like it was my responsibility. And those were the changing moments for me, So it's really important for me that I provide those opportunities to my clients and let them know, like, they do have a choice. Maybe one of the choices isn't the best choice. Maybe it's a simple choice to make, but it's their choice nonetheless. So all of those things, Carrie, yes, are absolutely true. And I want to empower them and the families at the same time, for sure.
That's such a golden nugget of wisdom, Erin. Thank you for that. And it's kind of in line with an approach that we intentionally do at Hope, which is really discouraging our staff around the use of no. That our young adults especially, but everybody that we serve, have likely heard a lot of no's. Right or wrong, right? So better or worse, but there's one no after the other. So we use phrases like yes, when, or and, yes, and it will need to, or whatever it is, or here's what we can do. But literally taking the negative and the no, it's not to say we don't set boundaries, because you all know we do that, but doing them in a way, like you're saying, it empowers very intentionally, because when we come to a place like Hope, or even through the doors of therapy, invariably people feel completely stripped of their own power and voice. And so all our job, isn't it, is to help that individual and family too find a positive, empowered voice.
Yeah, I totally agree with that. I felt the same way. My parents were telling me no. I felt like society, no, Nina, get it together. Don't do that. You're doing the wrong thing. You're making bad decisions. No, no, no. Can I do that? No, no, And it just is like, And the more I heard no, it's like I just went further, like
underground.
Yeah, it just sent
Underground.
me in the opposite. It had the opposite effect.
Yeah.
So for me, one of the most powerful things was when somebody put the ball in my court and said, "It's up to you, Nina." Like to me, it was a powerful thing for me to know if I wanted to go back to this old lifestyle, I could. Like the war on drugs is not going anywhere. Like if I want to go back to drinking, using, and doing whatever the heck I want, I can. Like, that's totally up to me. But I might as well at least try this other thing and decide for myself that I'm gonna at least try it and see what happens. And that's kind of what helped me, when people kind of gently said, "This is what we did. This is what I have found helpful. Why don't you try this?" Or Nina, what do you think would be helpful, um, for your recovery? Because there was, of course, like, ambivalence. It's totally normal I mean, people do destructive things like drinking and using and other things for a reason. It was my way to deal with anxiety and my insecurity, and blot out all the craziness in my head. And now I don't have that anymore. And so I think normalizing for me when I work with clients like that, like, you're going to have a part of you that, like, doesn't want to do this sometimes, and that is totally normal. Like, let's talk about that.
Mm,
Yeah.
and it's okay to talk about it and say it out loud.
Yeah.
Yeah.
Just say, I'm not sure. I'm
Yeah.
not sure if I want to do this again tomorrow, or,
Right.
forget for the rest of my life, but, for tomorrow. And, we deal with things like resident that's going to have their 21st birthday.
Yeah.
And there's the grief around that
Yeah.
for them, that this isn't normal, right? Normal 21-year-olds are going and getting drinks, or,
Yeah.
and
It
just
looks different than what they had pictured.
learning that it can look different.
Mhm.
And
I remember, sorry, Kira, I didn't mean to interrupt.
go ahead.
I remember when I was in treatment, obsessing about a glass of champagne at my wedding and being like, which I was, so I'd never had a glass of champagne in my life at that point. I don't know why that was so important to me, but like obsessing about this glass of champagne at my wedding. You guys can't expect me to not. And I obsessed. Well, I got married and I was, sober and in recovery. And I remember, everyone, we did the toast, and, my family and everyone had a glass of champagne and I had a glass of sparkling cider. And just as like we were going to cheers, it hit me. And I was like, I have not thought of this once until this very moment. And now it's humorous, like, it didn't affect me the way that I thought, not being able to have, the glass of champagne in that moment. Sorry, Kira, that's just what I was thinking of when you were talking about.
Don't be sorry.
So
That's exactly.
scary. Yeah, it's so scary. And then in the moment, I was just happy, I'm so glad I didn't have to have that glass of champagne. It wouldn't have gone well. So
I want to circle around to something that you brought up in the beginning, Nina, if that's okay, about the post-crisis issues, like the mental health issues, like the body image, and I think that's a lot of the work that you do in your practices as well, is that continuing to pull those layers of the onion. Once folks have stabilized, they're stable in one area. And I always think of it like we're pinching a balloon, right? That we've got the one area is manageable, but this whole other area of the balloon is now getting bigger and more pronounced and threatening to destabilize the whole thing, pop it. So can you talk about that kind of work that y'all do?
Yeah, absolutely. So a lot of times, like you said, it's just peeling back the layers of the onion. People get sober, they get stable, they start kind of rebuilding their lives, and then it's like whack-a-mole, like some anxiety comes up. Where did this come from? Or eating problems. So one of my passions is working with people in recovery with substance use disorders and that have these other mental health issues that come up, which often do, anxiety or eating disorders or, body image stuff, not feeling comfortable in their own skin or the feeling fat or thinking poorly about themselves.
And
And
just to find it's equally to those issues, the body image, as you're describing it, those are not specific to gender, that we see just as much of those body image issues in our men as in our women, except they just might manifest it a little bit differently, but they're present for both.
Absolutely. And it's probably not nearly as normalized to talk about it as much as females and girlfriends will talk about it together. Recovery is holistic, and it's not like you can take care of one issue and then it's like, okay, you're done, put that away. I love talking about, messages we received when we were younger about our bodies and food and how we carry those with us today. And I come from a healthy at every size approach. So I'm all about like throwing out the diet mentality. I feel like it's totally destructive. And just learning how to have acceptance and compassion for whatever my body looks like. Our bodies change. We know my body, I'm pregnant right now again, and my body is changing again. And it's very different than my first pregnancy. I've put on more weight this time, and that's okay. That's okay. Our bodies change. And so working through that stuff and those feelings with people is yeah, I love it.
I love so many
And Kara, I know
things.
you can relate. This is one of your passions too.
It is. And we have so much we could talk about. I mean, for a long time. There's so many things you said that can be expanded on. I think underneath it all, what I'm hearing is, we all just want to know we're enough. That's underneath the beginning of the abusing a substance, taking it from typical developmentally appropriate experimenting to, and hyper focus on body. It's about not knowing we're enough. It's a big part. There's so many things that we can talk about, and we are going to have a part 2 because we have barely scratched the surface, I think. I know that, yeah, Erin, I know you have a hard stop at a certain time, and we try to stay as focused as we can, but I know I can get carried away in conversation because to be with people that are like-minded, to know we're not alone that way is so, I just want to do this all day.
Yeah.
Part 2 coming next.
This was fun.
Yeah, thank you guys.
Thank you guys.